just a minute, 1 or 2 minutes, gonna start inshallah. Today the class or the session in Tanweer program about healthy and safety. I'm gonna start with healthy inshallah with just a minute, inshallah. Okay. Inshallah. Let's go online get live inshallah. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Good morning everybody. My name is Ihab Abdul Jawad Al-Faidi, President of Aman Institute, Imam of Islamic Committee for Critical Lean. Aman Institute is working on intellectual security, give awareness for parents, for youth, for families about security for the intellectual, for the youth and the families. Our message is to make awareness for youth and parents about the dangers that threaten the youth future through specialists in each field. Aman Institute presents Tanweer program, the current program right now, that gives awareness for youth and families about safety for the family on the internet, avoiding pornography, risky videos, gaming and other internet and social media addiction, cyber security, online dark web, protection against cyber criminals. Bullying, we make session about bullying, avoid academic failures, overcome addiction, depression, and suicide awareness. We did that. Avoid premarital sexual and extramarital affairs, plot for gender confusion. All these programs we present, and you can review it in our channel on YouTube. And today we have healthy and safety program. I'd like to welcome our guest speakers, Dr. Ryan Adams, Dr. Jordan Finkler, and Brother Usman Dankoua gonna join us, inshallah. Dr. Jordan Finkler, DDDS practice dentistry, in Lambesis, Texas. He graduated with high honors from the University of the Texas Health Science Center at San Antonio School of Dentistry, and completed the postdoctoral advanced education in general dentistry residency. Dr. Ryan Adams, MD surgeon, he completed his general surgery residency at Baylor Scott & White in Temple, Texas, which included significant training in trauma surgery. He has 4 children, married to his wife, Erica, for 25 years. And Brother Usman Dankoua, which is going to join us, inshallah, president of ICGK. He is co-founder of the Islamic Community of Killeen. He served in the U.S. Army for 26 years. Inshallah, the topic of today, it will be about healthy and avoid the influence and dangers of smoking, alcohol, drugs, and other intoxicants. Now I give a chance to Dr. Jordan gonna start, or Dr. Adams gonna start, inshallah. Who gonna start, inshallah?
Doesn't matter to me.
Okay, go ahead.
Okay, I'll start. Is that all right, Ryan?
That's just fine.
Okay, thank you so much for letting us come on and talk today. Dr. Ibab, we really appreciate the invitation. So, like Imam said, my name is Jordan, and I'm a dentist, and I practice in a small town in Texas. And I wanted to talk a little bit about a few things that I see that can really help you stay good and healthy. And this is just kind of the very beginnings of some things, and you can delve a little deeper into them on your own. But obviously the mouth is an important part of the body, and it's kind of where a lot of things come into the body. It's where our food and water come in, and a lot of nutrients. But unfortunately, at the same time, a lot of people use that opportunity to put things into their bodies that are not good for their bodies. And the number one thing that is used harmfully for people is smoking. Smoking, and when we talk about smoking, we're talking about tobacco specifically, is the number one leading cause of preventable disease or illness in the United States. And 1 out of 5 people, or 1 out of 5 deaths in the United States is related to a cause of smoking. So it's an extremely harmful habit, and it's related to many, many other diseases. Most commonly talked about is cancer. And so in the mouth, we also see cases of cancer, although it's very rare. It can occur, and smoking is the only risk factor for causing oral cancers. And so by not smoking, you greatly reduce the risk of all kinds of cancers, but specifically oral cancer or cancer in your mouth. But smoking can also cause other problems in the mouth. We see things like tooth loss. It makes the gums very unhappy, causing gum disease, allowing the teeth to get loose and falling out. And it does this by restricting blood flow and causing inflammation, which is the body's process of fighting foreign substances, things that it doesn't like. We also see complications with healing and the body's immunity, the body's ability to fight bacteria and disease. And so anytime we perform surgery in the mouth on someone that has a history of smoking, we see delayed healing. It takes longer for them to heal. They require more pain medication, which we'll talk about in just a little bit, but can cause more challenges and problems. So in addition to just losing teeth and cancer, we also see issues like staining of the teeth and bad breath, and caused by smoking. And nobody likes anybody that has bad breath. So, if at all possible, I encourage you to stay away from smoking tobacco. And along those same lines, it doesn't matter whether it's a cigarette, it's a pipe, it's all tobacco, or even an e-cigarette. While there's not a whole lot of research out on e-cigarettes right now, what we're seeing is that it's just as bad. And along those same lines, marijuana, there's not a ton of research out on it right now in regards to the mouth and how it relates to those things we've talked about with smoking, cigarettes, and tobacco, but it's appearing to be also very harmful in regards to health of the mouth. So hopefully we'll have some better research out on that before too long, and we'll know definitively the risks of marijuana. Next, I'd like to talk just a little bit about illegal drugs, drugs that people are either making or using illegally. And most commonly, we hear of one called methamphetamines or meth, and causing a condition called meth mouth. Could I show some slides, Imam?
Yes, sir.
Would that be all right?
Yes, sir, you can.
Let's see. I'll just show a picture here. I think a picture is worth 1,000 words. Is that showing?
Yes, I see it.
So meth mouth is a condition that we see in people that abuse a certain drug. And what this drug causes is it causes a lot of decay on the teeth. So the teeth start to rot away. And these are usually young individuals, young adults. They can be any age, but usually we see them very young adults. And this drug is very addictive, meaning once people start it, they have a hard time stopping it. But it kind of creates a perfect environment for cavities to happen. And what a cavity is there's bacteria in our mouth that breaks down the sugars or carbohydrates from the food that we eat. And that bacteria puts off acids, and that acid starts to break down our teeth. Now, the outside of our teeth is a material called enamel, which is very strong. And the inside is a material called dentin, which is soft and spongy. Our teeth are kind of like M&Ms. The outside's a hard candy shell, and the inside is some soft chocolate. And once that bacteria breaks through the hard candy shell, it just annihilates the soft chocolate. It goes very, very fast. And so you can see this picture of this individual that has several large cavities. And so certainly this is a cause of a relation of their diet, what they eat, and also their lack of hygiene, lack of brushing and flossing. And that's one of the things that the drug does so harmfully to these individuals, is they no longer care about their appearance, the way they look, the way they smell. And so they stop doing things to take care of their teeth. But the drug also causes them to eat and snack on foods that are not good for your teeth. They stay away from healthy foods like vegetables and fruits and proteins like meat and chicken, but they start to eat snacky foods and sugary foods that are bad for their teeth. And then lastly, this drug will dry their mouth out, makes them very dry, and saliva does a great job of protecting teeth and washing away the bacteria and the acid. So they found that out of people that use this drug, 96% of them, so almost 100% of them, had cavities in their mouth, and many of them were missing 6 or more teeth. Now, most kids have 20 teeth, and as you turn into an adult, you grow into about 32 teeth, but only about 28 of those are really functional. So out of 28 teeth, these people are already missing 6 teeth, which really handicaps your ability to smile, your ability to chew, your ability to talk and sing. And so it really, really makes for a challenging life to not have a full mouth of healthy teeth. Not to mention what it takes to try to correct all of the problems that it's created. Time away from school, time away from your family, expensive. It takes a lot to try to fix these teeth. And so it's a very, very harmful drug and substance. And we don't see it too frequently, but when we do, it's pretty catastrophic. So that's drug number 2 I wanted to talk about. And then the third drug is actually a prescription drug, and that's opioids. These are medications that doctors frequently prescribe. And while they are a good drug that helps to relieve pain, if used incorrectly, can be very harmful. And so just because your doctor gives it to you doesn't mean that it's safe to be used however you want. It should always be used within the recommendations of the doctor or dentist. And you've probably heard of these drugs, names like Vicodin, Norco, or Lortab, very commonly prescribed here in the United States. And they're good pain medication drugs. They help to relieve pain, and they also help you to feel good. So usually when you're in pain, you don't feel good. You're not very happy, but these will help with that. But you need to be aware that they can be addictive, that they can cause you to become dependent upon them and your body to crave them and to want them, and then to be used outside of how the doctor recommended them. And I bring this up as a dentist because about 25% of people that are exposed to these drugs, these opioids, comes from a dental office, and it's usually in teenagers who are getting their wisdom teeth removed. And so that's usually their first exposure, and if not used correctly and appropriately, can lead to problems. So before you accept a pain medication prescription from your doctor or for your kids from your doctor, I would always ask if there's an alternative, a safer alternative. And what we're seeing in the research right now is that a combination of Tylenol and Advil, those two together, is equal and sometimes even better for short-term pain management. So after a procedure like having a tooth pulled, Tylenol and Advil together, taken like the doctor recommends, is almost always more than enough. And so now those drugs can have issues by themselves, and no drug is perfectly safe, but they don't have the addictive nature that the opioids do. If you do have a prescription for an opioid in your home, if the person no longer needs it, I'd encourage you to get rid of it, to destroy it, throw it out. You can smash it up and mix it with some kitty litter or coffee grounds and throw it in a Ziploc bag and throw it in the trash. You can call the local police station, and most local police stations will accept them from you and destroy them properly. But don't just leave them in your house. A lot of kids are exposed to opioids by rummaging through medicine cabinets and finding them, and then taking them and using them, or family or friends find them or look for them and find them. And so to the kids on here, I would say, do not ever open up a bottle of medicine that you don't know what it is. Don't ever take it from your house and give it to your friends or family, because they should always be kept safe and used as the doctor prescribed. So just a few couple resources here. If you want to do some of your own digging, I highly recommend the website mouthhealthy.org. It's run by the American Dental Association, and their intention is just to educate people about how to have a healthy mouth and some of the dangers that we talked about today between smoking, illegal drugs, and even prescription drugs. And if you do know of anybody who suffers from a substance abuse, there are helplines and there is help available. So those are the kind of the big things that I see from a dental perspective as far as drugs and substances that can be used and abused. So.
Okay, thank you, Dr. Jordan. Brother Usman, any question?
Yes, we have a new epidemic of vaping. Does a dentist see any effects of vaping on the teeth of the children, those that come to your practice?
Yeah. Great question, and thank you. So vaping, there isn't a whole lot of good studies and research out on vaping and its effects yet as far as the mouth goes. But the general belief among dentists right now is that it is no better than traditional smoking. So whether you're vaping, whatever it is, it's no better. So all the risks of cancer, drying out your mouth, causing gum disease, delayed healing, increased inflammation are believed to still be there. In addition to that, there are some case studies, so some isolated incidences of e-cigs blowing up. Incorrect batteries were used and causing trauma. Blowing, knocking teeth out, breaking teeth, causing cuts in lips and tongues. And so the general consensus among dentists is that vaping is just as bad and potentially worse because of the added risk of trauma. So I would encourage everyone to stay away from it.
Well, on the subject of trauma, there's I don't know if you could answer this question. Trauma and mental health. What role these two factors play into the use of nicotine and other drugs. I don't know if you can address that.
It's a good question. So kind of the role of trauma, nicotine, and the youth. I think Ryan Adams is going to talk a little bit about trauma. I would say that, I don't know. I don't know that I have a good answer for you. Ryan, you have anything to add on that?
I could maybe speak to that a little bit. I don't want to delve in too deep, but I'll maybe touch on that when it's my time.
Okay, great. We can move on to the.
I have a question concerning if the negative impact for the people who don't smoke, any parents smoking, and children, the negative impact on the children.
Secondhand smoking.
Yeah.
So from a dental perspective, there aren't a whole lot of influences from secondhand smoke, but my understanding, and Ryan can talk more on this, is that there are still some significant effects from secondhand smoke on the whole body. Most of the effects we see in the mouth are from the primary smoking, the individual smoking.
Okay. Thank you so much for this beneficial information, Dr. Jordan. Now with Dr. Adams. Go ahead, please.
Well, thank you very much for the kind introduction and an opportunity to join this forum today. I think it's a wonderful approach to speak about these things, especially to younger children and their families, because now is the time to teach and educate. It's easier to prevention is the best place to start versus intervening later on when bad things have already happened potentially. And so, as you mentioned, part of my professional training includes responding to traumas and traumatic accidents. I have spent a fairly significant amount of time doing that among adult patients as well as children and children populations. And so, given the audience today, I'll maybe talk first about a couple things as it relates to childhood trauma. Childhood trauma is by far the leading cause of death among children, unintentional accidents. The majority of these deaths occur in motor vehicle crashes. Firearms are the second leading cause. Firearm-related injuries is the second related cause of unintentional death among children. And so, that being said, the prevention approach becomes very important to keep our children safe. The number one thing that parents can do and children can certainly take part in to decrease the chance of having a severe or a life-threatening injury from a car accident is to wear a seatbelt. There have been extensive studies, and there is a lot of data that shows just the simple decision and act of putting a seatbelt on decreases your chance of accidental death in a car accident. Certainly, there are guidelines for younger children as far as booster seats and rear facing versus front facing, and parents should certainly consider those guidelines. They are very easily accessible on numerous sites, but governmental sites have those recommendations posted very clearly. based on age and weight. But the overarching take home is wear a seatbelt. It's the easiest and most effective way at decreasing your chance as a child or as an adult in dying in a car accident. As far as another significant contributor to childhood accidents and accidental death come from head injuries. So how that generally plays out as children are doing things like riding bikes, on scooters, things that they enjoy and things that are a part of many children's growing up. The next most effective way to prevent a potentially catastrophic or fatal accident is to wear a helmet. That also has been extensively studied and has shown to be very effective. Bumps and bruises can't always be prevented in every childhood situation, but as it pertains to head injuries, taking a severe hit to the head or trauma to the head can be some of the most serious types of injury with long-lasting debility or results and occasion, fatality as well. So if children and parents focus on wearing a seatbelt in the car and wearing a helmet while riding a bike or scooter, anything that has potential of you falling and hitting your head, that would really cover a large and provide some protection and prevention at some of the largest causes of unintentional injury as far as that goes. Now, we live in Texas. We know that firearms are very much part of the culture of much of the population in states and places like Texas. Many firearms are used for recreational sports and hunting. Many people own them as for various reasons. And the point of this talk today is not to talk about whether or not people should have firearms, but as a surgeon and one who has cared for children who have been injured by a firearm, firearm safety and appropriate storing and handling of firearms is important. And so my recommendation, and you don't hear a lot of medical guidelines given on some of these topics that can tend to be somewhat controversial politically and socially. But so this comes more as my personal recommendation than guidelines from an institution or a governing body. But if you own firearms and have children in the home, there should be very deliberate safety measures in place, along with education and training. Children should know expectations of safety, what to do if they encounter a firearm and there's not an adult around. Additionally, if you in your family choose not to own firearms, there ought to be some baseline level of training about firearms and firearm safety, so that if and when a situation presents itself that children are where a firearm is, they have some prepared training or knowledge about what to do and how to safely be around a firearm. So those specifically are important for a childhood population from a trauma standpoint. I'll maybe just piggyback a little bit on what Jordan spoke on as far as the effects and the association between trauma and substances like tobacco, alcohol, or illegal drugs. There is a significant association between traumatic accidents and the use of these substances, specifically alcohol and illegal drugs. It varies based on demographics and population, but traumatic accidents, the association of drugs or alcohol and traumatic accidents varies somewhere from 25% even up to 75% in certain areas of that relationship. And so, yes, there are bad accidents that happen to people who steer clear of those things. But it is been shown, unfortunately, that if you choose to drink or use illicit drugs, the likelihood of having a traumatic accident goes up dramatically. And so, from a health and safety standpoint, avoiding drugs and alcohol decreases your chance of having a traumatic accident. The question was brought up about nicotine, and I'll touch on the vaping question. So vaping has been marketed as a better alternative to smoking, which in some regards that is true. When you vape, you don't have quite the number of toxic chemicals that enter the lungs and cause the damage that conventional smoking does. But vaping still provides the body with high levels of nicotine, and nicotine in any of its forms, whether it is smoked, vaped, absorbed through a patch, nicotine itself does inhibit proper immune function and healing. So any patient, there are many of my patients who I treat who regularly use nicotine, and in any of its forms, they are at a higher risk of having an infection or delayed wound healing after surgery. And so there are a lot of reasons why a dentist or a doctor would recommend not taking nicotine into the body, other than some of the calming effects, which is why it is used so broadly. There really aren't any other positive effects on the body or physiology that come from nicotine. Let's see. The other question was secondhand smoke. Some of the effects, especially on children and who are around adults who smoke, some of it varies. It's what we call dose dependent. The negative part of secondhand smoke is that if whoever's smoking uses a filter, that person receives the benefits of what is filtered through the cigarette. But if secondhand smoke is taken in by people in the proximity, those people don't have the benefit of having those substances filtered. But if you occasionally are exposed to secondhand smoke, that's very different than being around secondhand smoke nonstop at home. And so it really is dose dependent, or how often and how much a bystander is receiving secondhand smoke as to really the detrimental effects. But again, no positive effects at all for secondhand smoke. that we can clearly say that, and there is nothing positive from a health standpoint about secondhand smoke.
Sure. Okay. Brother Usman, you have a question?
Yes. Concerning the vaping, you mentioned that the nicotine, I think, was less going to the lung. But how about other chemicals that is put into the vaping? For my understanding is it contains nickel, tin, lead, benzene, and formaldehyde. You have any? Can you expound on that, please?
So I'll preface this by saying I am not a toxicologist, or my specialty. I'm not the leading expert, certainly in the big differences. Some of the delivery of the nicotine into the body from smoking versus vaping. Yes, you are correct. There are still harmful chemicals in the vaping, but as I understand, the actual damage to the lungs is slightly decreased through vaping. Unfortunately, and so in no way do I want to promote, hey, it's okay to vape. If you're not smoking, just vape. I would not recommend any form of nicotine. As you mentioned, there are still harmful chemicals, but the effects from and vaping has very much been promoted as a better alternative than conventional smoking. And unfortunately, many people, and children included, they see the vaping as much less harmful, which in all reality, I think the safety level is marginal. It should be considered nearly as harmful or just as harmful as conventional smoking. So, but yeah, that's a good question. I'm not an expert, though, to know all of those details.
Okay. We touched on the trauma and its association with the use of nicotine and other drugs. How about mental health? Do you have any input on?
Yes, I think as the way that I see that in my practice today is the association of mental health with and some of these addictive behaviors that very much play out in overall physical health. I see many patients who come in either through the emergency room or in my office, in my clinic, who have had unfortunately, many times they've acquired an addiction to one of these substances at a younger age, usually in the teenage years, and have had that challenge through most of their life, and many of the other decisions that they've made have caused them significant mental and physical damage. It is very common for me to see patients who, in addition to having a substance abuse problem, also have mental health issues, be it anxiety, depression, both. I see it very, very frequently that they come hand in hand. And unfortunately, a large portion of our population today suffer from both of those challenges.
Okay.
I'll add one point to that, and that is, we see the pattern fairly regularly of somebody has kind of an undiagnosed mental health issue of anxiety or depression. They have a procedure done, or a family member has a procedure done. Opioids are prescribed. They find them in the house and they start to self-medicate with those because they do feel better under them. Or they get another kind of medication from a family member or friend of, Xanax or another, anti-anxiety medication. And then they start to abuse those. And then that spirals out of control where they start to look for other drugs illegally. And so it goes back to the original diagnosis and treatment of our youth that, that we need to identify when they're struggling and need counseling and involvement from their parents or other adults or religious involvement, whatever it might be, to where we get them the help that they need before they start to go elsewhere and self-medicate and perpetuate the problem. So,
yeah.
Okay.
This question for Dr. Adams. What threat alcohol and other drugs pose to the organs of the body?
Oh, that's an excellent question, and I could go on for hours and hours about some of those things. I see patients regularly who have unfortunately consumed so much alcohol that their liver then becomes what we call cirrhotic, or it becomes scarred to the point that it is not compatible with life, and they either require a liver transplant or they die a terrible death, unfortunately. And so alcohol specifically for the liver is terrible. Many of the recreational drugs that are used have effects, especially cocaine has significant effects on the heart. We see many patients who come into the emergency room after having ingested some of these things, and they many times are in teetering between life and death because of the effects on the organs. One thing that unfortunately that we've seen is with social media and some of the trends that start up on social media, it entices many of our youth and younger population into experimenting and trying some of these things. And I've unfortunately treated several patients who come in with severe heart problems, severe kidney problems. I mentioned the liver. There aren't many organs that aren't affected in one way or another by these drugs. So certainly they negatively affect the organ, all of the organs of the body.
There's a correlation between the lung and smoking. Could you address that, please?
Oh, certainly. Lung cancer is a leading cause of cancer and death among men and women in the United States. and completely correlated to smoking and tobacco use. As Jordan Felkner mentioned, that as far as a preventable type of thing, tobacco use certainly is a preventable cause of we call morbidity or suffering, as well as mortality from cancer of the lungs.
Now, we talked about some of the things that people consume that is so harmful to the body. Maybe we could address something good that we take in that is good for the body. Water. Could you address the consumption of water and how important it is for the body, and how often should water be consumed?
Yes, that's a good question. So the majority of our body is water. 60% of the human body is made up of water. And so there's a reason why water is by most considered to be something that you drink every day. The majority of adults in the Western world don't consume enough water. It varies slightly between children and adults, but a good kind of round number would be 64 ounces of water a day. We can get by with less, but to try to care for our bodies in a very proactive way, drinking regularly throughout the day, and somewhere around 64 ounces of water would be a good, healthy recommendation for that.
Now, what impact not drinking water, what negative impact the body has or results from?
Yeah, that's also a good question. So dehydration can be manifest in a few different ways. The most common symptoms, or how dehydration is manifest, is in slowed mental capacity, or your ability to think clearly is impaired. The body begins to shut certain organ systems down to try and conserve the water that it has left. It always is going to try to protect the brain and the heart over everything else, and sometimes that comes. For example, you can suffer severe kidney damage by not drinking enough water, and so and it especially on a hot summer day, if you're outside playing sports or working hard outside, sweating a lot, dehydration can happen very quickly, and it can escalate to the point where you require hospitalization and immediate emergency medical care to reverse some of those effects. And unfortunately, sometimes it's not reversible in severe cases. But yeah, definitely an important thing.
Yes. Now, soda is promoted more so in our society than water. The consumption of soda, what impact, negative or positive, you think that it has on the body, the drinking of consumption of soda?
Very good question as well. So soda is one of the leading contributors to excess calorie intake and obesity that a large portion of the American population suffers with. Soda, much of the soda that we drink also has caffeine in it, which can be habit forming and is a stimulating substance, which is why many people drink it. Related to the dehydration, I do frequently, not frequently, but I do occasionally see patients who will come in and show signs of dehydration, but say, well, I drink a soda and tea all day long. Both of those substances, both tea and many sodas, have a lot of caffeine in them. And caffeine can act as a diuretic, meaning it sends a chemical signal to the body to produce more urine. And so people in certain situations will drink a soda, but because of the caffeine and the signal to the kidneys, they will actually produce more urine and dehydrate themselves because of the caffeine content of the liquid they're drinking. So definitely obesity is a big part. The caffeine source, and soda it's empty calories. There's not a lot of nutritional value in soda. I might also add, as part of this, energy drinks. Many of the energy drinks that are marketed today and available to many of our youth for consumption contain very, very high amounts of caffeine. And we regularly see people who come in to the emergency room having cardiac or heart issues related to excessive consumption of energy drinks, because the levels of caffeine are so high in many of these.
I'll add to that as far as teeth are concerned, we see lots of cavities due to soda and energy drinks, and even sports drinks, which have just as much sugar a lot of the times. So those drinks are acidic and have a lot of sugar in them, which is kind of the perfect storm for causing cavities. And so anytime I have a child that has a lot of cavities, my first question is always, what is this kid drinking? And it's almost always that they're drinking soda more than water. So at that point, the discussion is, this kid needs to be on water all the time, all day, every day. So we see it a lot.
So parents should emphasize the consumption of water over soda, would you say?
Absolutely. Yeah. I live by the motto of all things in moderation. As far as your teeth are concerned, drinking a soda on a Friday night with pizza, like once a week, something like that, is not catastrophic. But if we're drinking it, it should not be the norm. Water should be the norm, and soda should be a treat. So
yeah. Okay. While we're on this subject, mention urine and dehydration. Is there a correlation between the color of the urine and dehydration? Can Dr. Adams address that?
Yeah, that's also a good question. Yes, generally, as the body becomes dehydrated, it will attempt to preserve as much water as it can and still filter and get rid of waste products. And so as it tries to pull more and more pure water out of the urine will become concentrated, and those waste products that become more and more concentrated do tend to make the urine more dark, go from a light straw color down to a more dark brown or orange, or very dark yellow color. But yes, there very much is a correlation between dehydration. Now, there are different times, especially when, like when you wake up in the morning, while your body has rested overnight and cleared a lot of waste from the bloodstream through the kidneys, you can have some dark urine in the morning. That does not necessarily mean that you are dehydrated. But if you regularly have very dark urine, that certainly can be an indicator that you need to be drinking more water, or there are other things that can cause that, but dehydration certainly can as well.
Yes, sir. Okay. Dr. Ahab, do you have any
Yes,
questions from the community?
sure. The topic is healthy life, and we're talking about avoid smoking and drugs and all intoxicants. This is part, I think there is, as a doctor, there is more concerning food, concerning sports, practice sports, to enjoy healthy life, right? Can you address something about that?
Certainly. You're exactly right that there's part of prevention and avoiding certain things, but a big portion of a healthy lifestyle is doing things. As far as diet is concerned, a balanced, healthy diet with, like most of us, we're taught, fruits and vegetables, as Jordan mentioned, all things in moderation. I've even though water is good, if you drink, you could drink so much water that in such a quantity that you could actually cause harm. So all things in moderation, but choosing healthier foods, less fatty, less greasy foods, more lean proteins are recommended for heart health, and adopting an active lifestyle, participating in physical activity daily has been shown to have numerous health benefits, from decreasing your chance of having a heart attack and having heart disease, to keeping your body at a weight that doesn't cause premature wearing of your joints, allows for longer and better mobility. I mean, lots of benefits to staying active and engaging in physical activity at least 5 times a week, if not more.
Okay. Thank you so much. Chaplain Seth, want to add anything?
I'm happy to be here, and I just wanted to thank Dr. Felkner and Dr. Adams for their wise counsel today. I think that we'd all do well to try and make a couple of goals about how we can live a good, healthy life, and by improving what we're eating and what we're drinking, and getting out and being a little bit more physically active is very important, especially at a young age. And I just wanted to say that, the question came up earlier about mental health, and kind of the link that there is with illicit drugs and addictive substances that we were talking about today. And I feel like with the I get the chance to talk to a lot of soldiers, and purely on a mental health level. I have noticed that usually if someone is struggling with issues of mental health, generally I'm talking about anxiety or depression, I've noticed that they will also try to turn to illicit drugs or other harmful substances. And so trying to find good ways to work through our issues of anxiety and depression through getting outside, being with friends, and seeking help from counselors and religious leaders is a great way to make sure that you're remaining healthy. Yeah, I think that's what I wanted to say. Appreciate the chance to be able to speak. Looks like we've got someone who's raising their hand, though.
Thank you, sir. Thank you so much. For kids, any question? Asim, Kabel, Asma, Ismail, any question? Siddiqui?
Why does people need smoke?
Why does people smoke?
Yeah.
Yes.
That's a good question. Who wants to tackle that one?
Very good question. Why? From the beginning, why people are smoking?
I don't think there's a one answer for everybody, but I do see quite a bit of peer pressure. A lot of kids start at a very early age because someone else was doing it, an older sibling was doing it. They think it's cool. They say it makes them feel better. And so they start, and they don't understand the health consequences like we talked about today. They don't understand what's going to happen to their body as they start that. And so they started curiously, being pressured by others to do it. And it just perpetuates, and it's so addictive that they spend a lot of time trying to quit, and a lot of people are never able to. And for every year you smoke, it takes a year of not smoking to decrease a lot of those risks that we talked about today. So it's a very, very harmful habit.
Okay.
I think advertising has a lot to do with it as well. They advertise to children, and that's, as Dr. Faulkner mentioned, they to make them look cool. Peer pressure. If you're not doing it, you're not cool. And the way the manufacturers, how they advertise the product, directed at children. And so they try to get them, I think, at an early age. And if they can get the children at an early age to smoke, then they have them for their adult life as a customer. It's about that dollar. And so it is, I think, so important that we have forums like this where the children can be educated at an early age as to the dangers of smoking, or the use of illicit drugs, what it does to their body, to the organs, to their and the cycle of mental health and trauma. Because the link, as Dr. Adams mentioned about the link of trauma and when you don't take care, if you're to be safe, you may suffer trauma, and as a result of trauma, you engage in the use of illicit drugs, and the cycle goes on. So parents has a big responsibility to educate the children about the subject matters, and I'm very happy that we're having this kind of forum where the education can be brought to the children and parents as well.
Yeah. Thank you so much. Muhammad, you have a question? Unmute your mic. We cannot hear you.
I think he is unmuted. Just, oh, there we go. He's muted himself again. Let's try again.
Okay. Yeah, you have technical problem. Still unmute. Unmute your mic. Now you can talk. Raise your voice or move the volume. Make the volume up. We cannot hear you.
His microphone might not be working.
Yes, Kabel. Yes, I see it's a red mic. Yes, now. Oh, back again. You have a technical problem. We're dead. Okay. Till Muhammad come back. Any question, guys? Siddiqui and Ali, Asim. Any questions? Asma.
Thank you for the discussion.
Sorry?
Good discussion. Thank you for discussing that with the children today.
You are welcome, sister. Thank you so much.
Or can you? I was saying that stop touching. I was saying why are you a doctor? Because I want to know why. Do you like it or?
Say the question again, Muhammad.
Did you like being a doctor or like?
Why you like being a doctor? Okay. Why you like to be a doctor?
Good question.
I'll let Dr. Felkner go first.
I like being a doctor because I get to work with people, and every person is unique and an individual, and I get to help them live a healthy life and help them achieve the goals that they want. So it's the personal connections, getting to know people, and helping them live a healthier and happier life. It's very rewarding. It's hard. It's very hard, but it's a great job and great thing to do with your life. So if you're interested in doing it, I'd encourage you to do it.
Excellent.
My reason for being a doctor is very similar. As a surgeon, I enjoy being able to operate and do things to help people that they can't do for themselves, and that otherwise might leave them suffering, or they could even die. And so as a surgeon, I have a great opportunity to try and help people and help get them better when they've had an accident or when they have an illness or a disease. Many times doing surgery can help cure them and get them so that they're happy and healthy again, and they can be with their family and enjoy the things that they like. So,
okay. Thank you so much. Any other question before closing? Okay. At the end, I thank all of you, and special thanking for Dr. Jordan, Dr. Adams, and Chaplain Seth, and Brother Usman Dankoa. May Allah subhanahu wa ta'ala guide and bless. God bless you all. Thank you so much.
Thank you.
thank you.
Thank you so much. Thank you.
Bye.
Bye.
Goodbye.
Bye.
Like,
Bye.
Thank you so much.
Bye.